So as far as patients go, Jen,
Yes.
why is it meaningful or important to help these people? And how do you do that in your specialty?
They're suffering with something.
Mhm.
I mean, we talked about hair loss. Hair loss can be devastating for men, of course, but especially devastating for women. I personally lost 3/4 of my hair. Rick helped me. They don't feel like themselves. They lose their confidence. They, you know, people, whatever it may be, lost their job, lost their kids in a divorce, feel like they're worth nothing. And at least I can put I call it the frame, right? Face, neck, chest, hair. This is like a frame. We can put that back together and they can start feeling confident again. And when people feel confident, they do what they want to be doing.
The number one reason people go to the physician is pain. Whether that's chest pain from a heart attack, shortness of breath, back pain, nerve pain, headache. The number one and the number two reason for visits to physicians are headache and back pain. So fortunately, I'm in that field. I've had back surgery, I've had neck surgery, I've had ACL repair, I've had all kinds of stuff. But for me, the chronicity of that never affected me. But for many people, it does. And so I can relate on some level, knowing that acute pain that I felt like before I had my hip replaced was horrible, and they're living with this on a daily basis. So it's rewarding for me. I mean, I love to see people get better. Doesn't always happen. But I love to see people get better.
It used to be 50% of my practice was fixing other people's cosmetic work, other practitioners. We call them practitioners now because like everyone and their mom is doing cosmetics. But when somebody walks in and they're like, I don't know what's wrong, but I just don't look like myself anymore. Like I look crazy. I can't place it, or they don't even know that they look strange, right? They don't know. And I have to have these but seriously, they don't know. It's not their fault.
You have to tell them up front, hey, you look strange. You didn't know that?
No, I mean, no, I'm just like, I point out.
When your iPhone doesn't recognize you, something's wrong.
I mean, kind of.
It's not working anymore.
I mean, people are like, these people in cosmetic medicine, it's like they just want to get a sale and they're dumping all this stuff into other, these patients' faces. And they come to me and literally, it's like every patient, I'm fixing something fixed. Like, we got to start over. We got to do this. We got, even facelifts, like all sorts of things. Like if you saw the facelifts I saw, you would never get a facelift. Truly, from like really, it's sad. It's the people that they don't feel like themselves anymore. And so to give that back to them is really special for me.
When I was a third-year medical student and I was doing my ENT rotation, I was rotating in like ENT plastics. And the ENT plastic surgeon there, this was 20-something years ago, he was like, the way that he described aesthetics and plastic surgeries, he said, listen, he said, people deserve to be symmetrical.
Yeah.
They deserve to have symmetry with their face. And I am providing symmetry with their face. And they're going to feel more confident in themselves. And when a person feels more confident in themselves, and evidence proves this, they will be more successful in their aspect of life, whatever it is that they do. And I think that's what you're providing, is confidence. I think that's amazing.
Yeah, true. I mean, nobody wants to age. Nobody wants to face mortality. Nobody wants to go down that path. And then, going to other practitioners and then being botched over and over. And then they go to this one trying to fix it. It's even worse. It's even worse. It's a slippery slope down. So I think you have to be really careful.
From a skincare perspective, Jen, females want to know.
Yeah.
And I guess some males, I don't know, want to know like what's worth the investment.
Okay.
Like what should they be doing? You got to say you've got an attractive, a good looking, symmetric female or male. They're hitting 40, 45 years old and they're starting to notice aging in their face. What is worth the investment?
Okay. It's kind of like the question earlier, like what's the one thing I can do? But there's going to be multiple things you can do. So I'm using platelet-derived growth factor serum on my face right now. I'll just tell you what I have on my face right now. I'm doing my Hydra Boost, which is hyaluronic acid with a bunch of other things. Like I have a degree in alternative medicine as well, so I like to pull in alternative methods that decreases inflammation. There's a lot of things in that. But so I'm doing platelet-derived growth factors, my Hydra Boost. I'm doing a pigment clearer day.
These are all topical things. And how long does this routine take?
It takes me like 3 minutes or less.
All right.
I like to let it soak in each time.
All right.
And then
what's the cost of these products?
The platelet-derived growth factors are spendy. Yeah. We have a alternative treatment to that that's like a third of the price growth factors, hyaluronic acid. It also decreases inflammation. I'm doing a pigment clear during the day, so it's going to help antioxidant base. So you get the radiation, big ball of radiation is the sun. It's going to come in, it's going to oxidize your skin cells. We're going to put antioxidants on the face during the day to combat that. Then I do moisturizer, HSA based, so it actually is drawn into the cell, and sunscreen. That's what's on my face right now. And then nighttime, I do something very similar, but instead of the antioxidant, I do retinol and pigment clearing. So I don't like pigment clearing, like not, I don't know if you know what hydroquinone is, not hydroquinone based, but your kojic acid, alizac acid, vitamin C.
So
it's a prescription. I
The
came up
lava
with it.
soap doesn't work anymore.
No, I came up with it like probably 13 years ago, this combination for the brightening serum, and it's like incredible. So I do that every night.